Hello, I'm Dr. Basil Constein. I'm here from the ACU Online Writing Center, and today we're going to be talking about how to reference and synthesize case studies. Now, this is something that comes up in many assignments because case studies are a great way of looking at how to put theory and guidelines into practice. A case study usually will abstract some level of detail or provide you with a pre-created summary that lets you focus on the guiding principles and how they would apply to those select elements of the case study. So without any further ado, let's go ahead and dive in. Now, our agenda today, first to understand the principles of case study analysis, namely, why do you do it? Why do you refer to case studies or cases? And then we're going to look at an assignment that requires you to analyze a bunch of cases, and then how to refer to that in your text in APA style. And we'll finish with a brief look at outlining and drafting. So, what are you doing for case study analysis, and why should you do it? The first thing I'm going to do is tell you that we have a whole bunch of resources on this topic because it's so common. And so we look at a number of very specific assignments and also in some more general senses. So if you're very interested in case study analysis and you're not enrolled in the particular course whose assignment we're looking at, you might check out one of those for something that might be more what you would find most helpful. But let's ask the question, well, what is a case study for? Why have a case in general? Well, they're really helpful for generating ideas, for getting an idea of how you might use something or apply it, or what kind of things a patient might experience or be bringing to a session, to get an understanding of the subject, whether the topic or the type of people or organizations you might be trying to serve. Isolating details for comparison. When you have someone in front of you and you're trying to take down a patient history, it's harder to get everything compared to looking at someone having taken a summary down. Things leap out at you differently. Diluting potential bias, whether that's a bias of our own interests or our perceptions. Having a case or case study that someone else has written up lets us focus on just those details without complicating factors. Now, I will say that sometimes I work at hospitals, and I've been in the pediatric emergency department, and parents are often very stressed because their children are sick or in pain or both, and that is something that can bias someone. It could be as simple as thinking, oh, they're not thinking clearly, or they're exaggerating because of that. Well, that can also be its own bias. And so having this abstracted description, the notes that someone else has prepared, in this case, is really helpful. And cases are particularly helpful for our illustrating theories, concepts, or guidelines by applying them to real-world or real-world type situations. So, what is the purpose of a case study analysis? And I will say that the assignment we're going to be looking at looks at and asks us to analyze a couple cases with the specific purpose of finding out or determining what is most appropriate for each patient. And it's a way of role-playing the decision processes, sometimes to identify a phenomenon or patterns of behavior. You might spot some similarities between different patients, understand or explain a complex phenomena in a natural real-world setting, and generate generalizable conclusions. What have we learned from this? What might this guide other situations that might not be exactly the same? And before you start writing, ask yourself, how am I using this case or case study? And what do I need to tell the reader about why I'm using this? And what lens or perspective or purpose are you interpreting things with this case? Now, how you might cite a case study or case write-up, you start with a question, is it formally published and thus accessible to the public? If so, okay, great. We just cite and reference it according to whatever that source type it is. Is it on a website? Okay, we cite and reference it as a website. Is it on a website that the public can access, I should add. Is it in a book? Great, cite and reference it as a book. If it's not, though, if it's something that has been passed to you that I couldn't just hop on the internet and access, or hop on the internet with my journal subscription and access, then we're going to refer to it in the body of the text, but there aren't going to be parenthetical citations or an entry in the references list. So spoilers for students enrolled in the course whose assignment we're discussing, you would not include a reference for the case write-up itself. Now, for any of your course text that you're using to analyze it, yes, but not for the cases themselves. And that's really it. So, in the assignment, you might see something like, oh, in the Great Lake Food case study, in case 3.1, in the A to Z hospital case study, or in case 1, case 2, case 3, as it happens to be for this specific assignment that we're looking at, which happens to be looking at how you might select a hearing aid. Alright, so this is coming from the Hearing Rehabilitation course, and it begins with a brief preamble. What's the purpose of this assignment? To correctly identify patients who are candidates for amplification and select appropriate types of hearing devices. Okay, so we have the goal of what we're trying to learn to do, and we see that there's a description and of what we should be doing for each of the cases provided. And for each, we're supposed to consider 3 factors affecting hearing aid candidacy. Okay, so that's going to be referring back to the reading in the course module. What does that say you should be considering? And how do these manifest with this particular patient? What do you recommend? Amplification or not? Why? Which style of hearing aid would you recommend for them, and why? And that's going to be a combination of things in the case write-up and things in the guidelines. What are other important components noted within the case history? What might these pieces affect your approach as you make recommendations? And is it important to follow a medical model instead of a retail model? That's actually probably a more important thing now than in, say, 6 months ago, because of decisions about making hearing aids more broadly available. So more on that, perhaps as you are writing up. But the note to reflect on how your faith might impact how you approach treatment, that's very important. In this case, faith is functioning somewhat as you might be looking at, okay, how do we understand and explain a complex phenomenon? Well, that's exactly this. How does your faith lead to or change or guide what you might be doing? Alright, so if we look at the instructions here, we see that there is a breakdown here for the grading, and it's pretty much, do you do all the things that the instructions tell you to do? Now, it does note 7 points for each case. So what I would recommend as you were writing this up is to make sure that your write-ups are clearly labeled and you follow a clear order, so the instructor grading this can look through and go say, okay, yes, they did select an appropriate style for this one, check. They did identify relevant things in the case history, check. And, okay, yes, these things should affect my approach, and of course having that reflection. And there are ways that you can make that clear through headings, but also through explicit language and saying, oh, some important components to the case history are, and then your reader knows that's what you're doing there. So how should you refer to the case studies? Well, this is something that is perhaps simpler than many people imagine. We just want to be direct and specific, using language like, oh, in case 1, E period O period is, and that's the initials being used to refer to this patient, or this choice, whatever you fill in there, is appropriate for the patient in case 2 because of these reasons, as noted in our chart. Now, in at least one of these cases here, the patient isn't identified by name or initials. But if you say the patient in case 2, we know exactly what you are referring to. And again, because this is not a formally published case write-up, there's no parenthetical citation, there's no reference entry. Similarly, if you are referring to things in more than one case study, you might write up, oh, case is 1 and 2 both show. Or case 1 has a different set of concerns than case 2 because of X. Similarly, you might say, oh, well, this thing is a factor of concern in this case, for this patient in this specific case, whichever one it is. This is not the case for this other patient in this specific case. So using the same sort of specific language, and by the way, the cases are numbered. You treat them as proper nouns. So case 1, the C in case would be capitalized. Case 3, the C in case 3 would be capitalized. And you want to use Arabic numerals, so that, like this 1 and 2 that you see here. And that is actually all you have to worry about there. It is much simpler than people think. Some earlier versions of APA style required a more, we'll call it formal, indirect language that was in fashion in the 1980s, where you might have, well, the patient described in this case is, well, yes, but you could just say EO in case 1. That's fine. It's more concise and more direct, and those are things that are emphasized in the current version of APA style, APA 7th edition. All right, so how would you go about drafting that? How would you start your write-up? Well, we mentioned that the rubric does list a number of things that you want to get full credit for, and so I would recommend starting with having your paper labeled where you're going to put this different information. All right, so we have here a blank title of the APA course paper template, and we'll go ahead and we'll just start by pasting in the instructions here. So this is looking at each patient in turn, looking at each patient in turn, and looking at each patient in turn. Now this is more reflection as a whole. So what this tells me is that you could add a heading here called Applying Faith or something else. And we'll add the APA Level 1 style. So now this is centered and bolded and we've read it in title case. And we have, there's going to be some sort of intro where you outline the content of the paper. And then for each of these patients, you need to answer these questions. So you could have patient 1 or case 1. Either is fine for identifying them specifically. That'll be a level 1. And you can just go ahead and paste a couple times. And note you're going to answer each of these questions in this order for each patient. And you can start by putting in notes. And it's going to start with your recommendation. And it could be as simple and as direct as I recommend amplification for this patient, or this patient would strongly benefit. But the text does say, would you recommend? So why not start out with a very direct and clear answer, I recommend amplification, or I do not recommend amplification. Because if you do that, there will be no doubt about what it is that you are saying to do. Same thing with here. Use the wording here. Either I recommend, or the best hearing aid, or the most appropriate. I like the most appropriate. And so you can start taking notes as you read through these cases. Now you can refer to a variety of things here because you have a variety of media. And this includes referring to their test results. So you might be saying, according to their chart, their WRS for the right ear is whatever it is. And then that can be written up. For example, and because we have identified the case in the heading, And I'd say, let's name the patient when their name is available. People generally like it when you call them by their name. I recommend amplification for EO because whatever it is. Well, if you're now referring to their test results, EO's chart indicates that his right ear WRS is whatever it is, and then give your argumentation there. And so by doing this, you make sure that you systematically not only give information in the order that your reader, the person grading this, is expecting, but you also provide it with language that makes it clear you're giving that exact thing. And then once you've done that, you can remove these instructions, but make sure you've done them all first. So I do recommend crossing them off as you go, because then you have a reminder, oh, I should be listing the factors. And that's factors, plural. All right, well, this has been a brief tour through the process of looking and writing about cases and case studies. I do recommend taking a look at some of our other webinars if you want to dive deeper into writing about case studies. And for everything else, you can send us an email at onlinewritingcenter@acu.edu. Sign up for an appointment at my.acu.edu. Just go to the quick links drop down for resources and select Online Writing Center, follow the instructions, or visit the Online Writing Center website to find more webinars like this and other resources. With that, have a good night.